Hi, this is Major Bill Sherman from the 163rd Medical Group. On behalf of the 163rd Attack Wing, I'd like to answer some of the common questions I've heard recently about the COVID vaccine. First off, there's two vaccines. We have the Pfizer vaccine and the Moderna vaccine. Both of these have received emergency use authorization from the FDA. Therefore, they're not mandatory at this time and they're completely voluntary. And they're both 95% effective when given in 2 doses. As a healthcare provider working on the front lines, I've seen the dangers of COVID-19 and the damage that it's caused to people. Therefore, I highly encourage people to go ahead and get the vaccine so that we can protect the Air Force, the members' families, and their communities. So far, around 1,000 members of the California Guard, both soldiers and airmen, have received the vaccine, and we hope to do more so in the future. I'm going to go ahead and take some of these questions now.
Is the vaccine safe?
Yes, the vaccine is very safe. So far, there have been over 6 million shots administered in the U.S. alone, and over 20 million throughout 37 countries worldwide. Every vaccine in the U.S. has to go through the same safety and effectiveness trials by the FDA in order to get approval. The FDA does 3 different phases of clinical trials in order to get them approved. For this vaccine, there were about 80,000 volunteers that were selected and went through all the same different trials, safety, and data collection that was necessary in order to get the vaccine approved.
Are there side effects to taking the vaccine?
As with any medication, there are certain side effects that can be experienced. The most common side effects seen with the COVID-19 vaccine are pain, redness, and swelling at the site of the injection, slight fevers, fatigue, and muscle and joint aches and pains. There are some more serious side effects that can be experienced as well. These typically include difficulty breathing, rashes, and swelling of the face and neck. These symptoms typically occur within minutes to hours after the injection has been given. So therefore, it's important to wait around at least 15 minutes before leaving the site so that they can monitor you. When I got my shot, I had a sore arm for about 2 days. It didn't really affect my ability to do my usual activities. If you do experience any of these symptoms, you're going to want to notify your chain of command immediately. And if any of these are serious, you're going to need to seek medical treatment immediately, even if that means calling 911.
Will I get COVID-19 from the vaccine?
No, there's no possibility of getting the virus from the vaccine. The vaccine only contains a small genome, which is a portion of the virus. This portion encodes the spike protein. The spike is what makes the crown of the virus. This is what allows it to attach to other cells. Once the vaccine is in our bodies, the messenger RNA starts producing only the spike protein. Our bodies recognize the spike as foreign and attack it. Our body then makes antibodies against that portion of the virus. If the virus enters our body later, we already have antibodies ready to go to kill the virus. There is no live portion of the virus in the vaccine. The vaccine only contains a small portion of the encoding material so that our bodies can recognize it and kill it.
If I had COVID-19, do I need the vaccine?
Yes, the CDC still recommends that you get the vaccine even if you think you had the virus. The duration of the antibodies and immunity still really isn't known at this time. In addition, the testing isn't perfect. You may have had what's called a false positive. What that means is that even though the test said that you had COVID-19, in reality, you may have never had the virus in the first place.
Will we still need to wear masks and practice physical distancing once the vaccine is available?
Yes. The intent of the vaccine is to prevent the spread of COVID-19, but we're still going to need to wear our cloth face coverings and practice physical distancing to limit the spread of the virus. Until the majority of the population is protected, the pandemic is going to continue. We will continue to recommend wearing cloth face coverings and practice physical distancing for everyone until the risks of the pandemic is substantially reduced.
Is there anything else that you could tell us about this vaccine?
Yeah, there's a couple more things I would like to say. First, if you've ever had an allergic reaction to polyethylene glycol, abbreviated PEG, then you shouldn't get the vaccine. You should talk to your healthcare provider. There has been some talk of some new mutations that have arisen. However, none of these mutations have affected the spike protein to the point where our vaccinations aren't going to be effective for them. You should still get the vaccine because they're going to work against any of these new mutations. If you've received your vaccination off base, then you need to bring in documentation of receipt that's going to include the make, the lot number, and the date and location where you received it. If you want some more information about COVID or COVID-19, you can go to the CDC website. And lastly, I'd like to remind everyone that the 163rd Attack Wing is committed to the health and safety of our airmen, their families, and our communities. By working together, we can end this pandemic. Thank you.